I'm Theresa Ho, and I'm a physician assistant, also known as a PA, and I specialize in the shoulder and upper limb. Dr. Sohn and I work together as a team at Orthocare Health, in addition to our staff, to ensure that our patients feel cared for, comfortable, and well-informed throughout the entire surgery process. In this video, I will address some of the most frequently asked questions regarding our shoulder surgeries. When can I start physical therapy? This really differs depending on the type of surgery that you have. However, generally, physical therapy can start as soon as 1 week after your surgery or anytime after we see you back in the office for your first post-op appointment. Therefore, we usually recommend that you schedule out your first physical therapy appointment prior to having your surgery so that you don't start physical therapy too late. Are there exercises I can do after surgery before I start physical therapy? The answer is yes. So we definitely recommend that you start gentle, passive pendulum exercises 3 times a day, starting the day after surgery. And I'll show you a little demonstration right here. So now I'm just going to show you how to do passive pendulum exercises. And like I said before, you can start these the day after surgery 3 times a day. And each time you do them, you can do about between 10 to 20 reps. And so pendulums are very helpful because they help get the arm out of the sling so it doesn't feel very stiff after shoulder surgery. But they are completely passive, which means you do not use your own power to swing the arm like this, because that's active range of motion, but you just use the rest of your body's momentum in order to allow the arm to move. And so it's really just hanging there by gravity. So if we take the example of, say I have my right shoulder surgery, and so I'm going to take my non-operative hand and arm, which would be the left side, and I'm going to place it on a nice stable surface like a countertop, a desk, something that will not move and will give you stability. And then you're also going to place your feet in a manner in which that also provides you stability as well, and so that you won't fall. And so I'm going to have my arm in the sling, I'm going to have it taken out of the sling, and then it's just going to hang there by gravity. And then I'm just going to use the rest of my body's momentum to move the arm passively. And so just do small little movements. This isn't supposed to be large movements, just like that. You can go back and forth, and then you can also do these motions in a circle like that, and then you can also go side to side as well. And like I said, these aren't big motions, it's just to really allow your arm to feel comfortable getting out of the sling. And so that's how you do a gentle passive pendulum exercise. And like I said before, you can start these the day after surgery 3 times a day. Do I have to wear a sling? And how long do I need to wear the sling for? So yes, you have to wear a shoulder immobilizer full time for the first 2 weeks after surgery, including when you sleep. After that, you only need to wear it in public until the 6-week mark, at which point, after the 6-week mark, you don't have to wear the sling at all. The shoulder immobilizer will be processed through your insurance for authorization, and then it will either be mailed to you or you may have to go to the durable medical equipment office to pick it up. Please bring this with you to the day of surgery, as that's how we will place it on for you after surgery. So here I just want to show you a couple of important parts of your shoulder immobilizer. And so you can see there's a main section right here for your shoulder and for your arm and your shoulder sling. And then this right here is the bumper that sits across your waist and is attached from the back and clicks in right here. And this portion of the sling goes across the back of the neck and clicks in right here. And so a couple of important things to note. I want you to make sure your elbow will always be in the back all the way through here, that it's not slipping forward at all, causing some space here, but that it's just sitting very comfortably here all the way into the back. And then right here is the nerve ball. And so essentially this is something important that you need to continually squeeze throughout at least the first week or so after the surgery while you're in the sling to allow the blood to flow. This right here is important strap for your thumb. And so, your arm won't be able to slide through like that if you place it right here and allow the thumb to sit comfortably like that. And then this strap right here is a strap to go across the top to make sure that your arm doesn't go up this way. So hopefully that helps with being able to become a little bit more familiar with your shoulder immobilizer sling. So now I'm going to go ahead and show you how to put on and off your shoulder immobilizer, which can be helpful especially if you're alone at home and you wanted to start doing your pendulum exercises. And so typically this is how the shoulder immobilizer sits. You're in your arms portion of the sling that goes around the back of the neck and clicks in here at the side. And then you also have this bumper portion that goes around the back of your waist and clicks in here in the front. So going ahead, taking on and off the sling, I want you to be in a nice seated position, a nice safe position. This is usually how I like to do it. And we'll start off by removing the waist strap. So we're gonna go ahead and unclick that. We're gonna let it just hang there. And then I'm gonna go ahead and then remove the shoulder strap. And after I remove the shoulder strap, there isn't much holding this together. And so I want you to place it on your lap afterwards. And so go ahead and remove the shoulder strap. And then you can go ahead and remove this strap, place it on the bumper, remove this strap, the thumb strap, and place it on the bumper as well. Lean forward in your chair, and then just allow your arm to slide out naturally with gravity. And then you can just allow it to sit there on your lap. And when you want to go ahead and put it back on, you're going to do the same steps in the opposite order. And so again, I'm going to go ahead and lean forward, allow my arm to hang there by gravity. Don't move it on your own power. And then I'm going to go ahead and allow it to slide into my sling. Place that bumper across your waist again. And then make sure your shoulder, your elbow is all the way back into this space so that there's no emptiness there. And then I want you to put your straps on. So go ahead and put the thumb strap on again, make that comfortable. And then put this top strap across the section here as well. And then next you're going to take the shoulder portion, the portion that goes across the back of the shoulder. Make sure it's not tangled. And then you're going to click it here at the front. And then lastly, you will grab your waist portion. So it's okay to stand at this point if it makes it a little easier to grab the waist strap. And then you just click it here in the front. And now your shoulder immobilizer is back in place. What medications are necessary for surgery? So we typically prescribe several very important medications for our shoulder surgeries, including the first of which are narcotics. Narcotics are for pain control, as the first 3 days after the surgery are usually the worst in terms of pain, and we really hope to get you off of narcotics as soon as possible. Number 2 is an anti-nausea medication in case you have any nausea. Number 3 is a stool softener in case you have any constipation. And number 4 is an antimicrobial gel that helps to prevent shoulder infection. And we actually have you use this gel for 3 days leading up to surgery, so before surgery, including the day of surgery after your morning shower. And like I said, this helps to prevent shoulder infection. And then 5, we typically recommend that you get some over-the-counter vitamin C and take at least 500 milligrams of this daily to encourage tendon healing. When can I shower? Good question. We ask that you keep your dressings clean and dry and out of the shower for the first 3 days after surgery. After 3 days, you are welcome to go ahead and go in the shower and get the area wet. We just ask that you don't absolutely soak the area. If you have any stitches that do need to be removed, we will go ahead and take them out for you at your 1-week post-op appointment. When can I drive? We usually recommend that you do not drive for at least 6 weeks after surgery. What will my recovery timeline look like? So your recovery will really depend on the specific type of shoulder surgery that you have. But generally, we usually don't allow patients to lift their arm on their own power for the first 6 weeks after surgery, or lift anything heavier than a coffee cup or your cell phone for the first 12 weeks after surgery or the first 3 months. How does disability paperwork work? So all EDD paperwork needs to be filled out online at edd.ca.gov. You'll be provided with a R number, which is also known as a receipt number, and you will need to provide this along with your desired or required return to work dates to our office so we can help you work on your paperwork. We will continue to evaluate you throughout your post-operative period to determine when you can return to work and if you need any sort of work restrictions. How much will my surgery cost? So procedure cost estimates will be provided by our billing manager. However, they are rough estimates of our portion of the cost. All other facility fees and anesthesiologist fees will need to be discussed directly with the surgery center or hospital you are having your surgery done at. I hope this video has helped answer some of the most common concerns you might have before and after surgery. Of course, please do not hesitate to reach out to our office with any questions or concerns. We look forward to taking care of you.